Welcome. Thanks everyone for tuning in. We've got a really important conversation about behavioral health ahead. But before we introduce our featured presenters, there are just a few housekeeping items that we'd like to go over. First, today's webinar will be recorded. As you sign on, follow the audio connection prompt and then also dial in with your phone using the phone number provided. We ask that everyone please mute their phones. The presentation will follow with Q&A. And if during the webinar you experience any technical issues or have any questions, please submit a question or comment using the Q&A console on the right side of your screen. You can resize the window by dragging the right corner of the slider. Also, there will be participation through polls and chat, so we're looking forward to hearing from everyone. Now, it is an honor to introduce the featured speaker who's going to lead us through the conversation today, Dr. Vincent Nelson. Dr. Nelson is Vice President of Medical Affairs in the Office of Clinical Affairs at BlueCross Blue Shield Association. He will also be joined later by our special guest, Dylan Landers Nelson, a director at the Business Group on Health. Dr. Nelson, hello, and thank you for doing this.
Hello, Keisha, and thank you. I'm very honored to be speaking to you all about this very important topic, behavioral health, and sharing solutions around behavioral health. So I'm very happy to be here.
Great. Can you give everyone a sense of your role?
Yes, so I provide clinical leadership across multiple disciplines, quality management, provider recognition, medical policy and service delivery, innovation, and I work to ensure that the Office of Clinical Affairs and BlueCross Blue Shield Association offer guidance that aligns with members' needs and makes a positive impact on their quality of health care.
That's great. And I know that gives you a unique perspective into the state of behavioral health, its impact on employers and their workforce, and really what can be done to address it. Dr. Nelson, I wanted to now turn it over to you, but first, since one key to promoting behavioral health and battling stigma is openly talking about it, can you kick us off by sharing a way that behavioral health has impacted you personally?
Surely. So I started my career as an anesthesiologist and pain management physician on the front lines. I performed procedures on thousands of patients in over the decade or so that I was in full-time practice, in both the academic space and private practice. There were always patients, though, that I had difficulty ameliorating their pain, whether it was from an underlying disease like cancer or the disease itself was the pain. I would refer them to surgeons or other specialists, largely in the field, but they would usually come back with the referral response of, there's really nothing procedurally to do in addition to what you've done. So that had me take a step back and reimagine my practice in three ways. One, I figured out that I was not talking to my patients enough. And sometimes that happens with specialist providers. We tend to gravitate toward the procedures that we can do or the therapies or the medicines that we can prescribe. And so talking to my patients more and really getting to the root of their conditions, both physical and mental, and behavioral health was key to me getting over that barrier to enabling them to lead a fully healthy life. Secondly, I learned to coordinate with specialists in the behavioral health space and not just in the pain management or similar spaces that I was used to dealing with, and understanding when I needed to hand off those patients based on a referral or what medicines or therapies that I could do before I was able to hand them off was key in coordinating their care. And then lastly, fully coordinating their care with their behavioral health specialist was something that I learned that you had to pace along with their physical condition. When you do both, the patient gets better, you feel better as a physician and provider that you're providing the right care, and you see that the patient cannot be fully healthy unless they are treated both from the physical disease and also behavioral health standpoint, and that's why we're here today. With that, let's get into the core of our webinar. I want to thank you all for joining us. Let's talk a little bit about why we're here and what you can expect in this webinar. We will look at the full scale of behavioral health challenges that your employees and you as employers are facing. We're going to walk through key domains and define the actions that can take place to address these challenges full on. We're going to highlight some examples of what BlueCross and Blue Shield companies are doing in these areas. And then we will have a conversation with our very special guest, Dylan, from the Business Group on Health to get his view on what's needed and where they've seen successes. I want to take a moment to reiterate what Keisha told you about the chat function. Please use the chat function when you have questions that spark from the conversations and the dialogue that are going to be taking place today, so that we can be sure to collate and prepare those for us towards the end. And we're also going to be doing a series of polling just to keep you engaged and have this more of a dialogue and a conversation. So we're going to start with our first polling question. Which would you say is most true about the impact of behavioral health on your workforce? Should it be that this is a rising top challenge before the coronavirus pandemic, A? B, it has come to the forefront during the pandemic? C, both A and B? Or D, it's not a challenge yet at all? But we're looking to get ahead of it. We're going to give you 15 seconds approximately to answer that question, so we're going to take a pause. Please select your answer. Okay, let's see what answers we have so far. It looks like C has received the most responses, with not even a second one that's close. So both A and B, both that this is a rising top challenge before the pandemic and that it's come to the forefront, which are both excellent responses. So you can see where this talk is going to head. The impact of behavioral health has been a top concern for some time and is only growing. Some have called it the hidden pandemic. But now employers and employees are facing behavioral challenges on a whole new level. In many cases, their whole way of work has changed because of the pandemic and the public health measures we have had implemented in order to combat the pandemic, i.e. social distancing. And many of the experts agree with you that going long term, the COVID-19 pandemic is going to have tremendous negative impact on the numbers of behavioral health conditions that will only see an increased number, such as anxiety and depression and stress, and this will affect businesses immeasurably. There are many solutions out there that are taking on parts of what's needed, but BlueCross Blue Shield companies are working across our networks to share the insights and the actionable solutions for a full health approach to broaden the view of behavioral health and connect behavioral and physical health. Today, I want to talk to you about taking on those challenges across 4 key domains: improving access, integrating care, reducing stigma, and creating a culture of health. Today, we're going to show how bringing full health into focus can not just provide better health care, but improve health in its total, making care more effective and efficient. Simply put, make it better, lower costs for businesses and their employees, and therefore lead to a healthier, happier workforce. Improving access. Let's move to integrating care. improving access. Let's start with looking at how we can improve access. There has been a 900% increase in calls to the Federal Crisis Hotline over the past year. And no doubt, crisis hotlines across the U.S. that are not federally connected have also seen similar numbers in increase in the number of calls to their hotlines. This is just one sign of where the need is right now. When we talk about access, we're talking about several things: the availability, the convenience, and the affordability of which all the obstacles that employees face when they are seeking behavioral health care. These barriers have also really been tested during the pandemic. It's time for another poll. You'll see it up on your right. Of these focus domains, which one do you feel is the leading barrier to employees getting care? Is it A, availability, B, convenience, C, affordability, or cost? As you're being given these 15 seconds to respond, as I mentioned, these are all big challenges. Just look at behavioral health providers, which I call the supply side of this equation. A full 77% of U.S. counties have a shortage of psychiatrists and other behavioral health care providers. The average wait time to see a psychiatrist prior to COVID was 25 days, almost a month. Can you imagine what it must be now? The supply issue within behavioral health care is front and center, and there are many ways that you can solve for it. Let's now circle back to our poll. Let's see what our answers have uncovered. It looks like C, affordability, received the highest number of responses, and availability was second. Affordability is definitely one of the main drivers, if not the main driver. Cost remains the number one barrier to accessing care, but at least one study has found that eliminating a $10 copay can double employee utilization of these resources. So it demonstrates how incremental cost has with allowing your employees to utilize these resources. Truly astounding. So what's the solution to the access challenge? The truth is there's a lot of ways that you as an employer can improve access. First, expand resources. Evaluate and expand resources. Try to include more points of access, from virtual care to on-demand and on-site clinicians and counseling, and use your influence. Tell your healthcare partner you want more multidimensional care providers in your networks. Get smart about affordability and screening. Think about affordability and screening. By working with your health plan partners, you can lower or eliminate copays when it comes to behavioral health and make no-cost screenings standard. This is a really good way to remove cost and make care more accessible for everyone and reduce stigma as well. Really drive awareness. Drive awareness by talking about behavioral health whenever you're talking about health in general. Make it as much a part of the conversation as physical health, something I outlined that I learned in my many years in practice. Use internal communications to promote the affordability, the effectiveness, and the types of behavioral health resources your company makes available to employees for easy access. Make virtual care a priority. That was not really available when I was in practice, and it is a wonderful tool that we need to leverage more and more, particularly because of the pandemic, but then also going forward. Make virtual care a priority. With all the new stress many of us are under, we've seen an uptick in the adoption or engagement with virtual care platforms, from everything from talking with a therapist to getting better sleep. And it's not just about convenience. Recent studies have shown that virtual care is often as effective, and in some cases more effective, than in-person visits. Not everyone is comfortable speaking with a physician face-to-face or another provider. Sometimes they like having that digital platform with which to engage. In fact, we've seen that virtual care usage has increased 1.6 times since the summer of 2019, with half of that growth since the start of the COVID pandemic. This is why BlueCross Blue Shield is bringing in more telehealth platforms, cognitive behavioral therapies, resiliency apps, and digital tools designed to connect employees with the care that they need. A good example of this is Wellmark Blue Cross and Blue Shield's partnership with Doctor on Demand, offering employees the option to receive medical and behavioral health treatments via a device. These virtual visits are a standard benefit for most members, and even if virtual visits aren't covered under a member's Wellmark health plan, they may still be more affordable than regular trips to a mental health professional, particularly when you account for transportation and time off from work and other implications that go into a total cost equation. Next up is the area of integrated care. As I alluded to with my time in practice, comorbidities can be an issue when you're dealing with patients. Comorbidities are the tendency of certain conditions to lead to other conditions. This is very true in pain, among other disease states, where your behavioral health affects your degree of pain and sometimes whether or not you have pain. This link is very large. Take depression too as an example. The estimated annual cost of depression in the U.S. is on the order of $210 billion. Around 60% of that cost is related to the treatment of comorbid conditions such as diabetes and heart disease. There has been a growing trend among employers toward integrating physical and behavioral care. But even with this awareness, we still see a couple of things happening. Healthcare still often operates in silos. That coordinated care aspect, I told you that also I had to relearn. And in many cases, an employer may utilize an employee assistance program or EAP for behavioral health, a health assessment service for physical health, and point solutions to address specific situations or conditions. Let's look at the numbers. They make a pretty clear case for integration. Patients diagnosed with a chronic disease are 2 times likely to have a behavioral health condition. It is also true the other way around. Someone with a mental health condition is more likely to have a chronic disease. The healthcare cost for treating those individuals with chronic medical and behavioral health conditions is on the order of 2 to 3 times higher than those without behavioral health conditions. Yet studies have shown that integrated care can lead to as much as a 17% per year savings for the employers. Again, you, the employers, play a major role in pushing integrated care forward. More on the how. Treat the whole person. Make treating the whole person the goal. Talk about and model your approach around the idea of behavioral health is as important as physical health, where you can embed mental health into the existing efforts like your chronic disease management programs that are already in place or those that you need to put in place. Join networks that work together. Consider provider networks that are working on integrated care. Look for networks that connect primary care and behavioral health specialists or even specialty care with behavioral health specialists. When records and information are shared, a whole picture of health is possible and can lead to better care. That coordination is especially key to make sure that we have a fully healthy patient, member, and employee. Connect the whole continuum and support health plan partners that go even further to empower those PCPs, those primary care providers, specialty providers with behavioral health providers so that they collaborate. Again, remember that what you value has influence. So tell your health partners how important this is to your company and help to scale collaborative care models when you can. BlueCross Blue Shield is helping employees design plans that develop patient-centered whole person care. One example is Blue Cross and Blue Shield of North Carolina work with Quartet Health, a leading mental health technology and services company. Quartet Health's digital platform not only helps with the early detection, screening, and diagnosis of patients, but also helps primary and behavioral health providers coordinate a mix of collaborative, face-to-face care, teletherapy, and track employees' progress. For example, through sharing information like a health plan's claims data and medical history, the platform uses predictive modeling to spot employees who may need behavioral health support. Primary care providers are then prompted to screen these at-risk employees for behavioral health conditions. If needed, the primary care provider will deliver the right care or refer the employee to a behavioral health provider who can, and then providers use the platform to communicate virtually and coordinate care. All of this is aimed at connecting employees to the right care at the right time, targeting both chronic conditions and behavioral health needs, and lowering the total cost of care. I featured this on a recent blog, which we will put in a link in the chat box for you all to check out when you get a chance later. We're now going to move to, unfortunately, a very unfortunate way that we need to reduce stigma around behavioral health. Another leading barrier to behavioral health care is the stigma around seeking it out. It's still very prevalent. And as the COVID-19 crisis continues and those public health measures that we've had to continue, which are social distancing, which is not a natural state for the human condition, has added anxiety and stress, which means companies need to open up to ways they're helping their employees feel comfortable of discussing their emotional well-being. It's time for another poll. Okay, what percentage of employees do you think said that they would be more comfortable speaking up if leaders talk about behavioral health? A, 25%, B, 38%, C, 45%, or D, 62%. You're going to get 15 seconds to answer this question, and then we'll see what you all thought. All right, let's see how you all are doing. It looks like the one that got just more was C, 45%, with 62% being a close second. It's actually 62%. By creating an open dialogue and speaking personally about mental health, leadership at all levels can empower employees to seek out the resources they need and can offer support along the way. So let's talk about it. How can we do that? Start at the top, but don't stop with the top. It's great when senior leaders are involved. Stats like the one I just shared show how much that you can encourage your employees, but this has to run deeper. All management needs to be engaged and supportive. The power of leadership is enormous. It has been said that it's probably the greatest gift that has been given to civilized humans. Make behavioral health business as usual. Really make behavioral health care business as usual. Talking about behavioral health and available resources and encouraging employees to use them should start day one. This tremendously reduces the stigmatization of the idea of even seeking behavioral health. But going full on means normalizing those benefits, policies, and the dialogue. Keep the dialogue going. This is critical to reducing stigma. Create a constant set of opportunities for employees to talk and to weigh in about behavioral health, and be sure to act on what they tell you to build trust and demonstrate accountability. Ask your guest speaker, Dylan, As your guest speaker, Dylan, will tell you, you should also look at programming as cultural, multidimensional, and even peer-to-peer. This is a key area of focus for Blue Cross and Blue Shield companies, and there is a lot of great work being done. For example, Blue Cross Blue Shield of Western New York and Blue Shield of Northeastern New York have dedicated time and effort and focus into understanding and reducing stigma associated with behavioral health for a long time now. In their role of helping organizations create a culture of health, they have, for example, developed broad public campaigns like their Painkillers Killed initiative that addresses substance use disorders. They're also working with Doctor on Demand, the telehealth application that was mentioned prior, to provide members with a stigma-free access to professionals in the behavioral health space. And they have a Strong Mind Health Fair that's dedicated to helping employees see what behavioral health resources are available to them. They offer a wide range of member tools, such as WellFrame, an app providing a virtual connection to a care manager and educational content, and My Strength, a fully self-guided digital behavioral health app specifically focused on combating stress, anxiety, and depression. And they provide training, support, and incentives to primary care providers who incorporate behavioral health specialists and screenings into their pediatric primary care. Now we're going to talk about creating a culture of health. Companies have developed wellness programs promoting a healthy workplace, eating right, for instance, exercise, mindfulness, etc., things of that nature, for a few years now, but that might not be enough. Employees are still struggling with physical and behavioral health challenges as they look for a balance between work and life. Then the coronavirus hit, and it changed how companies work, displacing or dramatically affecting much of the workforce. And all of this has elevated stress levels and added new stressors. When we're already at a point where as many as 550 million workdays currently are lost to stress each year. Let's look at this number and tell me what you think. Here's another poll. 64%. What is this percentage? Is it A, the percentage of workers who report that their jobs were extremely stressful, or B, the percentage of millennials who report feeling a sense of overwhelmedness at work? We're going to give you 15 seconds to answer this question. All right, this is a shorter one, so let's see how you all did. A, the percentage of workers who reported their jobs are extremely stressful. Actually, that's not a bad answer, but the correct answer is actually B, the percentage of millennials who feel overwhelmed at work. The millennials who are the future of the workforce, or as our featured speaker will say, are the current workforce, say their jobs are overwhelming. Millennials face many behavioral health concerns across Blue Cross and Blue Shield companies. We've also heard firsthand through a multi-year initiative focused on millennial health that they want healthcare to be more holistic, and they're specifically looking for workplaces that make it part of the culture. Creating a culture of health is where you are really empowered to make change. How can you further make those changes? Expand non-medical benefits. It's so important to find ways to connect behavioral and physical health offerings as well as non-medical benefits, from financial programs to tuition reimbursement to work from home options to transportation allowances. These all affect employees' census of well-being. Think about organizational factors. Consider the entire work environment, the policies, the processes, and the impact that they have on every employee's health and well-being. Aim to be more inclusive, reducing stigma and unnecessary stressors wherever you can. Show your employees that their needs matter. See this as a chance to show employees that your needs matter, that their needs matter. We've talked about listening, learning, and building an environment around what they say is impactful to their health and well-being. A great example of creating cultural impact is how BlueCross Blue Shield of Michigan promotes a culture of well-being in the workplace and in everyday life through a series of live weekly webinars led by a well-being coordinator, some for employers and some for the individuals, whether they're members or not. The employer webinars highlight a variety of topics to help build a strategy and create a healthy, thriving environment for their workforces, covering a range of things from tips on staying organized to how to run employee health challenges to well-being roundtables. While webinars for individuals focus on self-care tips to manage mental and physical health, these webinars provide inspiration and motivation to make their overall well-being a priority. Employers and individuals can visit the BlueCross Virtual Wellbeing website to register, watch past webinars, or download well-being content. It's all available for you on-demand viewing and printing. Now, with that, we will continue this discussion with our special guest and business leader who will drill down on many of the areas of focus that I've outlined thus far. Dylan Landers Nelson. He is a director at the Business Group on Health, an organization that does a lot of work on both the employer and provider side, including programming, research, and many other activities across all of the areas we've talked about today and more. And just lastly, we are unrelated. And with that, I will welcome Dylan. Dylan?
Great. Thank you, Dr. Nelson. Can you hear me all right?
Yes, we can hear you. Dylan, let people know what you do as a director at the Business Group on Health, and you can give your unique perspective on behavioral health as well.
Sure, absolutely. So yeah, thank you for having me on the webinar today. As was previously mentioned, I'm a director at the Business Group on Health. We're a nonprofit member association. We represent about 440 members, the vast majority of which are large self-insured employers. And we work with the health benefits and HR folks at those companies who are making decisions around healthcare strategy, benefit design, contracting, and supporting the full health of their workforce and covered dependents in both physical and emotional health. My role as director, I've been at the business group for about 6 years now, and I do a lot of work around issues related to payment and delivery reforms as employers increasingly interact with the healthcare delivery system, evidence-based benefit design, and several other issues, particularly like my life is like COVID these days. But I'm very lucky to be in a role where I help coordinate across our entire organization the work that we do around emotional and behavioral health, brain health, mind health, mental health, whatever you want to call it, you know, the topics that we're here today discussing. So it's a great opportunity to work across the business group because we know that the brain is a part of our body, and as you mentioned earlier, there's a lot of comorbidities. Mental health impacts physical health and vice versa. Because it's all, you know, it's all one body. So it's a great opportunity at the business group.
Thank you for all of that. Now, I know you have some specific best practices to share But I have to ask you, as I was asked, one last segue on, could you share a personal behavioral health experience that you've had or someone that's close to you?
Yeah, absolutely. I feel like my family runs the gamut of mental health issues, and I say that with love for my family on both sides. But you know, unfortunately, one of those was losing my brother-in-law to an opioid overdose last February. And losing Tim was a really horrible experience, obviously, for him, and I know that he had a lot of you know, pain both emotionally and physically, as you were mentioning earlier, in and out of rehab, certainly very expensive treatment that ultimately was not successful. And, you know, of course, you know, our family is still grieving. So, you know, it's I think, easy to look at, you know, a pandemic or an epidemic and see these really big numbers. And, you know, unfortunately, if you haven't been touched by it, I think it can be a little bit abstract, but it's important to remember that, you know, every single time we see these numbers or hear these stats, that it represents, you know, real people. And so, you know, unfortunately, some personal experience in our family, but one that's informed a lot of the work that I do and the way that I approach this work as well.
Wow, thank you for that very poignant and personal response. It's hard to move off to our next subject, but let's try in terms of, I know you have some best practices to share in a few slides. I'm going to turn it over to you now.
For sure, yeah. So if the powers that be can put on the slide with the word cloud, I will try to lift this up here a little bit, because I do understand that you know, talking about that is a huge bummer. So this is from a survey that we did from about 70 large employers back in January, where we had them all in a big room in DC, and we asked them, you know, what is your top concern related to mental health? And you'll see there that access is far and away the biggest challenge, but stigma was certainly a big one, as well as, you know, things like stress, depression, and addiction that are, you know, specific conditions of focus. I think this access issue gets back to what you were saying, Dr. Nelson, around, you know, affordability. I think there's such a dearth of provider options in so many parts of the country that we just have to be very careful about messaging, you know, as we do communications around anti-stigma and we're encouraging people to seek care, that there's actually got to be some meaningful care for them to be able to receive. And I know a lot of the, you know, hundreds of people on the line here are working to make that happen. And so, you know, I certainly appreciate that you're doing that. I'm going to talk a little bit more about stigma in the next couple slides and approaches. So if you could move to the next slide. I want to talk about, this is a survey that we did of our broader membership. So this is about 170 large employers that answered this question. And I want to particularly highlight the middle question here. This was a survey that was done last summer, asking these companies what they would be doing the following year. So this is reflective of what they're doing in 2020. And you'll see that there are some pretty solid trends here in terms of those employers that are implementing anti-stigma campaigns, from 18% of them just a few years ago to now almost half. You'll see related to that, right below that, is training managers to help recognize mental and behavioral health issues. And down at the bottom, you'll see peer training as well. So I just want to point out that this is a big, you know, certainly a big trend and focus for a number of our large employers. Let's go to the next slide. So, you know, in terms of talking about best practices, and I know that we're running a little bit low on time, so I want to be brief in my comments here. I think there are a few things that we want to make sure that you take away from this, from the employer perspective. One is your leadership has to be involved, not just the C-suite, but we find that those employers that have the best success with driving utilization in their employee assistance programs, driving a positive culture, seeing results in employee surveys year over year about whether people feel supported or they feel like they can reach out for help, is if the leadership, but then also the kind of leadership trickling down closer to the work site is kind of pushing the message that it's okay to seek help, that here is where you can find resources, that, we are a company that cares about you and wants you to, feel good about working here. There's one company in particular I'm thinking of where during their onboarding sessions for new employees, when managers or other staff are doing that onboarding, part of this discussion is about the employee assistance program, and they make it just a normal part of the discussion of being an employee, is that you've got this benefit, here's how I've used it in the past. It doesn't have to be about, here's how I've gotten my depression treated. It can be, a lot of these EAP programs have really basic kind of life support options that a lot of people don't know about. And so by making it part of that onboarding process, you can really normalize use of these services, and they've seen some really good results from that. The third one here, weaving in narratives. I think the important part in this one is success stories. So I didn't do this on purpose, but that, mentioning my brother-in-law, Tim, passing away and, family grief, it's all really awful. If I were to share that as a story to say, and use the EAP without saying, by the way, my family has benefited tremendously from the therapy that they were able to get connected through the EAP, that there are millions of other people who have had substance use disorders and have successfully gotten treatment and are doing okay. You really want to make sure that you are weaving in successes, not being overly rosy, but also not leaving people feeling like they're actually even in more despair than they might have been otherwise absent your communication. Another one that I think is very clear, but just don't shame or blame people, that's kind of like, that is stigmatizing. So you just want to make sure that, we would suggest that you do focus groups with employees beforehand to find out what it is that they're challenged with getting access to mental health care. We've seen in some cases when we've done surveys of HR folks that they think stigma is a huge issue, but then when we do surveys of employees, they're really focused on not being able to get time off of work and the lack of affordability of treatment. So being able to tailor your messaging to your employee population is really helpful. But you can also test out some messaging with, employees that you might consider to be leaders who are supportive of this, to make sure that, again, you're not unintentionally actually stigmatizing some of this. And then I think it's important to, when you're targeting communications, don't just target communications to people who might be suffering. When we talk about stigma, there's that internalized stigma that people feel that may be preventing them from seeking out care. But unfortunately, part of why they feel that stigma is because of the kind of broader population, whether that's kind of in our society, also in a particular workforce. And so, you want to help people who aren't necessarily going through mental health challenges understand that they should not stigmatize other people or other people seeking treatment. So it's just an important distinction there. And then finally, because I know we're short on time, I just want to say it's important to track your results. So employee surveys year over year, you can ask questions not saying, do you feel stigmatized, but do you feel supported at work? Do you feel like you can go to your manager if you need help? You want to just make sure that you're tracking your strategy over time so that you have a sense of whether it's working, and then also, frankly, you can pull back if something doesn't seem to be working. So those would be my suggestions. It's great to be here. I'm happy to follow up with anyone in the course of the webinar or afterward.
Yes, thank you for all of that, Dylan. That was very helpful information and insight that you provided. We're going to now open up with the remaining time that we have left. We're going to open up to our audience to chat in questions to us. And while we are waiting for that, and I think Keisha's also going to come online to join us, I just wanted to go a little bit further on the idea of stigma. I know from my experience, and I'm sure from yours as well, is that stigma can be seen and be effective or negatively affecting different groups of people differently, i.e. race and ethnicity, rural versus urban, socioeconomics, and I found that it's important that you have people that are from diverse backgrounds talk about their specific stigma, things that have occurred to them or makes them apprehensive about seeking behavioral health resources, essentially through their lens. Can you expand a little bit better on that?
Yes, absolutely. So it's a great question. We have worked with the Johns Hopkins Stigma Lab, which is one of the leading academic centers for understanding. They do research on stigma specifically, and stigma related to a lot of things, but mental health is certainly a big one. And they emphasize this point that different audiences, like you said, are going to receive messages differently. And, there's a lot of, academic research on connecting with clinicians that think are from the same kind of areas as you. There's a certain comfort in that. I think also, we've seen, different experiences at employers that have a higher percentage of their population that's men, and stigma tends to be a little bit higher in those organizations. So, you do have to tailor your messages in ways that's going to connect with those folks. And then I really appreciate your point about race. I think about the current, situation, the world that we're living in right now. I'm also cognizant of the fact, Dr. Nelson, that I'm the lily white guy sitting here, but it's impossible to, talk to my coworkers of color and not, understand that there's just a different load of stress and impact that the current situation, about race relations and police violence and violence with, just the social kind of situation that we're in right now leads to different burdens of stress, and there's stigma related to seeking treatment, and just the way that you as an organization managing, the total health of your employee population, it's going to be a diverse population, and you're going to need to have diverse strategies for supporting them. So, it's an incredibly important point.
Thank you, Dylan, for expanding on that. Do we have Keisha on the line now? Keisha, are you going to?
Yes, I am. Thank you. I just want to reiterate that. Thank you, Dylan and Dr. Nelson, for those great insights. We are now going to take probably the next 10 minutes for Q&A, and I'm actually going to kick things off and take the first question that we saw come through. It was a question on the chat that asked if we could repeat the stat about copay. So I'm going to give the answer to that. At least one study has found that eliminating even a $10 copay can double employee engagement and resources. So I just wanted to make sure that we were able to repeat that stat. All right, so here's the next question, and I'm going to open this up for either Dr. Nelson or Dylan to answer, or both. And here's the question. I've heard reports that the COVID-19 pandemic may have long-term effects on our mental health. What is your take on this, and how can employers prepare to best support their employees in the future?
Well, I guess I'll start it off, and I know Dylan will have about the research behind that, and then I'll let Dylan talk a little bit about what employers can do, although I might touch on it as well. So in a recent research study, a meta-analysis of pandemics actually, and social distancing measures, population-based measures that keep us apart. So the Ebola H1N1, the other sort of smaller pandemic, but those that had required some level of social distancing, those that, those persons, those people that were subject to those social distancing had reported higher levels of behavioral health issues than those that did not. And that also carried forward past the pandemic with those same individuals being followed as a cohort. And so using that as a guide, and I can, if anyone wants to contact us and I can get you the reference, it was this year, it was only a few months this year, we are most likely going to see lasting effects. Now, how long? I think in that study it lasted for at least a year to 2 years out as far as some of those pandemics. And so we can fully expect that this will not stop with whenever there's quote unquote a vaccine or some other therapy that dramatically reduces the transmission and the effect. And I think, and I'm going to turn it over now pretty much to Dylan, but just saying that a lot of what we spoke about at length throughout the, throughout this webinar are the things that need to be acted on by employers to make sure that employees are well taken care of during this period that's truly not really going away in any short time period. And I'll let Dylan speak from there.
Yeah, for sure. So a few thoughts on this. One is, I think this highlights the importance of employers kind of flexing their strategy. I remember, vividly in March when we had our last staff meeting while we were all in person before lockdowns, and it was kind of the jokey, like, all right, we'll see you in a couple weeks. And there were, how naive we were, right? And there were some new policies that were put in place, and it was, something to support us through a relatively short period of time. Cut to almost 5 months later, employers are going to have to be constantly reevaluating their strategy for supporting the health of their employees overall, and mental health is certainly one of them. Dr. Nelson, you mentioned earlier about millennials, and I myself am one. We are a cohort that's pretty much all working age now, depending on how you define it. I think the youngest millennials are in their early 20s. And I look at my 2-year-old daughter and I think about all of the other, kids who are kind of growing into the workforce now that are going through this profoundly weird experience that is, pretty likely going to impact their mental health and the way that they approach social situations and, look for psychological safety. So absolutely, we fully anticipate that this is, the silver lining is that it's highlighting the importance of mental health. But unfortunately, we think this is going to be, something that's going to be impactful for a very long time.
Wow, thank you both for that. And this is a related question. As more companies are extending their remote work policy through 2021, are there any areas of concern for the American workforce as it relates to their mental health?
So I'm happy to jump in. I think we are absolutely seeing a number of our employer members returning to work, or they would say returning to the work site, because so many people have been working from home that, it's a big focus of theirs. But for office workers like myself and a lot of other companies, they're just not planning on sending people back anytime soon. And in some cases at all, they're finding that there's actually increased productivity from people who are working from home. You don't have your commute. The issue is that work and life are kind of getting blended and blurred in a way that we're starting to see some companies report issues of burnout, and that the current situation is not really sustainable. I would also highlight the issue of childcare. That as schools largely don't open up in person this fall, that you're just going to have also a very large group of people who are juggling many, many different things, and stress levels will continue to rise. So, from that perspective, I think absolutely it's going to be a huge challenge. I think, loneliness will continue to be an issue, as people have been spending a lot of time outside during the summer. Thankfully, we know being outside is a little bit safer than being inside for the most part. As we get into colder months and it's harder for people to spend time outside, there's kind of a natural release valve there between physical and mental health that you lose out on. Kids can't be outside as much when it's cold. So certainly there's going to be an evolution, and the longer that, we're all kind of under the thumb of this pandemic, it's going to continue to be a challenge, if not get worse. So it's got to be a priority.
Thanks for that. And here is our last question. And Dylan, I think this might be a question for you. Do you see employers coordinating behavioral health benefits between their medical plan vendor and the EAP provider? And then do you see where TPAs are now providing EAP services along with their other TPA services?
Yeah, absolutely. So we see both amongst our membership, and I think the thing that we hear from members either way, the important part is trying to keep things as coordinated as you possibly can. I think that's a benefit of having one vendor kind of integrating everything. We have a number of employers that are working with point solution providers to extend virtual mental health services even beyond those. But the challenge that you run into is, the further you kind of get removed from a person's kind of standard medical, benefit and the medical providers that they see, you just run the risk of further disjointing, the care that they're receiving or the benefit coordination that can be really supportive. So, we see both models. I think there's probably merits to either, but that integration and kind of rationalization of benefits and experience with the healthcare system is something that we hear, particularly from leading employers, is a major concern.
Thanks for that. Well, this has really been terrific. I want to start by thanking everyone. Thank you, Dr. Nelson, for leading the conversation today and sharing so much that employers can really start to do and think about implementing. Thank you, Dylan, for joining us and providing your perspective on the real challenges and success you've seen at Business Group on Health. And thanks to all of you in the employer community for your time today and for giving Full Health your full attention. If you'd like more information, we have a full suite of resources, starting with an ebook that covers all of the areas we mentioned today. We have blogs like Dr. Nelson mentioned, infographics, videos, and there's even more to come. You can find it all at smarterbetterhealthcare.com, so check it out. Once again, thanks everyone, and have a great day.
Thanks, Keisha. Thanks, Dr. Nelson. Thanks, everyone.
Yes, thank you all.